probably don't know this about psychological addiction, but some people have a drug of choice. So a T3 is a circular white powdery pill. A tramadol is like an ovally beige one that's shiny. One of those is very triggering for me, and one of them is not. Even as a child, I abused anti-nausea medication because it made you sleep. And I only ever took Gravol, a certain brand name. The pill was a circular orange powdery pill with a line in the middle. And now when I get anti-nausea medication for flying or whatever, I specifically try to buy like liquid gels or an off-brand that is a different format, because just looking at that alone, I think about all of the times that I had that in my hand and the feelings I used to get. But if I'm holding a different pill, I don't have any association with it. When you're using these things for what they're meant to be used for, you're supposed to just feel normal. Like when I'm taking tramadol every day, I'm not high. You know what I mean? Like I just am, my pain is managed. To feel the like euphoria that's so addicting, you would have to take more than they prescribe you. So if I don't do that, I can take the pill and not be triggered because I don't feel high. I feel like I'm not in pain. I feel like the conversations around addiction in society were started by Alcoholics Anonymous, which is like the fucking Christian cult of addiction, where they believed in 100% abstinence. But some people are able to manage it. There's alcoholics who are, their liquor of choice is vodka, and they can have a glass of champagne and not like relapse. There are so many different factors going on in your brain when you use medicine or substances. If you always engage in that substance in a specific area, your body prepares itself for it. And if you use the same amount of substances outside of that environment that you typically use in, you can OD because your body isn't preparing for it, which is a huge issue with addiction and homelessness because you are constantly moving around all the time. I was taking hydromorphone before the tramadol, which is stronger. These are actually the same, but it's stronger than both of them. And it didn't work at all. And it's a fucking opioid. It did not faze my body at all. Like, it's complicated. But if you don't, like, learn about it, you're very ignorant to it, and all the assumptions that everyone makes and judges people for, they just have zero comprehension of. And those stigmas enable addictions, which is just so sad. I fucking wish people just stop making assumptions and just listen up.